So I always say that sex at its heart, it's about communication. That's what it is. It's about sexual communication and really talking about it before you do it.
You're listening to In Your Pants with Dr. Susie G, the physiotherapist for your private, helping you get in the know, down the low.
Hi friends, Dr. Susie G here, and welcome to another In Your Pants podcast. Thank you so much for being here with me today. On today's show, I have an amazing guest. His name is Dr. Lee Phillips, and he is a sex therapist. But not just any sex therapist, a sex therapist who has devoted his career to helping those who identify with having a disability or chronic illness regain and reestablish their connection with their sexual identities and help reframe a more sex positive experience in their lives. So, despite society's assumptions around sex and disability, those who identify living with a disability or chronic illness are sexual beings with sexual curiosities, needs, and desires for sexual freedom and expression, just as non-disabled folks. Disability and sexuality are not mutually exclusive. And in today's show, Dr. Lee and I really break down some of those barriers or myths related to sexual health, disability, and chronic illness. In particular, we discuss some of the worries and fears that someone who identifies with having a disability or chronic illness has when entering the dating world or is in a current coupleship. How do we navigate those difficult conversations? And we talk about compassion, acceptance, and really finding ways to positively connect with one's own sexuality and perhaps reestablishing that connection as a sexual being and being comfortable and confident to be able to express our needs and desires in perhaps some very difficult and challenging situations, such as, getting into the dating world. So, we also talk about some red flags that one should notice when beginning to date. Dr. Lee shares with us his favorite dating apps. And also we talk about how to effectively communicate our needs, our desires for pleasure and eroticism, especially if we're identified with having a chronic illness or disability. And lastly, we chat about how our partner or partners can respond to ways in which we discuss sex and our sexuality and how to go about that. So I hope you enjoyed today's show. I had a blast, and this episode is filled with insights of wisdom and really good advice. So before we jump into the episode, I'd like to formally introduce Dr. Lee Phillips by sharing with you his bio. So Dr. Lee Phillips is in private practice in Reston, Virginia, where he specializes in couples therapy. He is a licensed clinical social worker in Washington, D.C., Maryland, Virginia, and Florida. He is a licensed, a certified substance abuse counselor in the state of Virginia, and he is a certified sex therapist by the American Association of Sexuality Educators, Counselors, and Therapists. In addition, he is a certified sex and couples therapist by the Integrative Sex Therapy Institute. He has been in private practice for more than a decade, working with individuals and couples on sexuality after chronic illness. Dr. Lee lectures on topics including sexuality, chronic pain, anxiety and stress management, caregiving stress, depression in the elderly, mindfulness and cognitive strategies for chronic pain, reclaiming sexuality for couples with chronic illness, ethical decision making, the assessment of mental disorders, and exploring sexual communication, freedom, and pleasure for gender minorities with chronic illness, pain, and other disabilities. He has published in the Journal of Baccalaureate Social Work, conducting a research study on LGBTQ affirmative teaching at historically Black colleges and universities, called Understanding Program Directors' Views. He has been a featured expert in Teen Vogue, Healthline, and the Lily newspaper. He writes for Psychology Today. Dr. Phillips is writing his first book, Sex and Love When You're in Pain, which helps couples overcome shame and the sexual limitations caused by illness and gives strategies to create and reclaim a sex life that works. He is the host of the Sex and Chronic Illness podcast. His podcast features stories from individuals, couples, and other experts in the field of overcoming shame and the sexual limitations caused by illness and disability. He holds a Doctor of Education degree in organizational leadership with an emphasis in behavioral health from Grand Canyon University in Phoenix, Arizona. In addition, Dr. Phillips is an adjunct professor in the Masters of Social Work program with the School of Social Work at Western New Mexico University, and he is an instructor for the Integrative Sex Therapy Institute and with Modern Sex Therapy Institutes. He can be found at drleephillips.com, and all of Dr. Lee's information and resources that he shares with us in this episode will be linked in the podcast show notes. So please be sure to visit drsuzyg.com for the podcast show notes. So without further ado, please let me introduce you to Dr. Lee Phillips.
Hi, Dr. Lee. Thank you so much for being on the show today.
You're so welcome. Thanks for having me. I'm excited to be here.
I am so excited to have this conversation with you. I think, talking about sex and disability and chronic illness is a topic that no one is bringing attention to. I mean, well, I would just say no one because we're having this conversation, but it deserves more of a spotlight and recognition. That's for sure.
Yes, it does. And you're right, in the field of sexuality, we're not hearing a lot about it. And I think we're starting to see a shift now in that where we are, because 40% of the US population is chronically ill. And so people want to be sexual despite having a chronic illness. So yes, we're starting to see more work in it.
And so that's a great to have a chronic illness or disability. And I know there are, two, I don't want to compartmentalized, but technically kind of two camps, a parent versus non-a-parent. Could we talk a little bit about that and what that means?
Yeah. So with disability, it could be a number of things. You can have a chronic illness and you can completely be disabled. There's disabilities where you're born with a disability. So for an example, some folks are born with cerebral palsy. We have dynamic illnesses that come on the scene, different autoimmune disorders, neurological diseases. I work a lot with folks that have fibromyalgia, multiple sclerosis, lupus, Lyme's disease. So those are more of your dynamic illnesses where they go into relapse and remission. But then we do have static disabilities where they kind of remain the same over time. And I see that with cerebral palsy. So those are the groups that they kind of go into. I work a lot with chronic pain patients. So they may have chronic pain due to an injury or pre-surgery, post-surgery, or they've got chronic pain due to a chronic illness. And with chronic pain, it's, lasting 3 months or longer. We know that there's the chronic issue that is there. So those are the folks that I primarily work with.
Right. So complementary to my practice as well, especially when we're dealing with sexual pain or men or male identified individuals who have chronic prostatitis, chronic pelvic pain, any type of sexual pain that you just can't see on the outside, so to speak, right? It's an invisible illness, but so can be very disabling, frightening, scary. And then what does that mean for our sexual identity, our relationships? How does that all pan out? So I'm so excited to dive into those details with you. So what would be your advice, Dr. Lee, for those who find it frightening to share what they're living with to a potential partner, which is potentially hindering someone from stepping into the dating world?
Right. So I work with a number of people that have chronic illness and disability. Some of those folks are single and they're wanting to date. And then I work with couples or people that are in relationships that have a chronic illness and the other partner does not. And so one of the things that I think we look at first are the stages of a chronic illness that folks go through. So a lot of times there's a crisis phase where there's a lot of chaos, there's a lot of symptoms, they don't know what's going on. The rug's been pulled out underneath their feet. They don't have no idea what's going on. So in that stage, they go to seek medical attention first.
Mhm.
However, I've had couples and individuals show up in my office that are in that stage, not very sexual. They're not feeling very sexual then. But then we see something called stabilization, where maybe they've gone to a doctor or they've been bounced around to several doctors and now they have a diagnosis. So now they're learning to adapt to the illness. They're learning to see what the symptoms are.
Mhm.
They may have started medication by that point. They're around a lot of specialists. And so sometimes in that stabilization phase, they're coming into therapy and they're learning to adjust to this new normal that's happened to their body. And so, with that, sometimes in that stage, they're ready to talk about sex. They still want to have sex, they want to see what that is like. And a lot of times, it's having this sexual communication that has to happen instead of looking at what is achievable, it's looking at what is possible because it's kind of like this idea of being in a new body.
Mhm.
And so I may not have the same sexual desire, or I may not initiate sex as much. So we see a lot of that as well. We also see a resolution phase where they are trying to integrate parts of their old self into the new self and make those adjustments. And
Mhm.
so one of the things that we do a lot of as sex therapists is a lot of normalizing. Like, this happens to people a lot, right? We know that there's been a change here, but guess what? You can still be sexual. You don't have to have penetrative sex. You can do other things.
That's
that's what's so
right.
gr- that's what's so great about sex is that we have options. There's no right way to have sex, and it's crazy because I have people that come into my office thinking that there is all the time. So that's how we approach it, I think, as therapists. And I'm sure you do the same as you do a lot of normalizing what you're going through. Hey, this happens to identified males. We see this, and I'm going to help you to be a sexual being. So,
Oh, I love that. Yes, a sex positive message here as far as yes, it's challenging, validating, very affirming, and saying, what can we do to reconnect, reestablish your connection to your own sexuality or sexual identity as, a sexual being who has sexual energy. And it doesn't have to look like
mhm.
this cookie cutter mainstream social cultural framework of one way of having sex or doing sex. I mean, these are such
Yes.
debilitating messages to all beings, I think, because it just sets us up for
Mhm.
these unrealistic expectations. And when those are not being met, that's a huge hit.
It really is. And there's a lot of shame that goes with it because I have people that come into my office and they're like, my body is broken. So therefore, I'm not supposed to have sex. Or they will come
Hmm.
into my office and a doctor has never mentioned anything about sexuality to them. I've had cancer survivors come into my office and say, my doctor told me I should be lucky just to be alive.
Oh,
Well, I am lucky to be alive, but hey, I'm also a sexual being.
right. That doesn't mean I stop having
And I
sex,
want to Right. And I want to reclaim that. I want to reclaim my sexuality. I want to be able to be a sexual being. And so one of the things that they do is we come into my office and there's first of all, there's two things that really have to happen too. There's a grief process. So
Hmm.
sometimes in that grief process, they're not sexual. And so when we get into a place of acceptance, which I think is very powerful doing acceptance work, then they're able to say, okay, this is my body, this is where I'm at. I built a relationship with my illness. Now let me work when they can do that.
So, so, Dr. Lee, you're bringing up a really important point about grief and loss and how it's important to really acknowledge and to help support someone through that process of reclaiming their sexual identity. But it sounds to what I'm hearing you say is that in order to be able to reclaim and go through that process of acceptance, one has to also work through the grief and loss or navigate the grief and loss. So could you share with us like what that process would look like. And I know that's variable from person to person, of course, and coupleships and stuff
Mhm.
like that. But could you share some insights into, what someone might be able to do as far as, hey, how do I recognize that this is what's going on for me? And then what are some things
Mhm.
that I can do to help myself through that process?
So one of the things that I think is powerful, and I call therapy the safe container. Sometimes it's just coming into the space to be able to process and talk, because a lot of times I find of the majority of my patients, they can't talk to family about it. Family doesn't understand chronic illness. They don't understand chronic pain. There's this idea that if you're able to walk and you can see and you can hear, you're healthy. That's not the
Mhm.
case. And
Yeah.
so there's so much going on inside of the body. And you know that with the work that you do. And so what we find is there's these stages that folks go through, and sometimes there's a denial phase, and they have to sit with that
Hmm.
and process that, and they can't believe it because it's a chronic illness is a trauma, and
Yeah.
so they're wondering, how did this ever happen, and then after this trauma that they're going through and this denial, we go into anger. There's a lot of emotions, so being able to process those emotions, looking at the thought process, being able to sit with the client, being able to offer supportive therapy. And then there's bargaining. They're wishing they could just go back to the body that they had. So
Hmm.
giving them a chance to talk about that, to say it out loud. And then of course there's a lot of depression that comes with it.
Hmm.
And that shows up with everything. There's a lot of comorbidity with chronic illness, right? That's why
Hmm.
psychotherapy is now becoming the number one treatment for it, because when you're able to decrease your anxiety and depression, you can manage your chronic pain a lot better, you know? And so then after that, we have acceptance, where you accept where you're at. And that's where I really see people want to become sexual. So we go through those stages. The thing to keep in mind too is that people oscillate in between those stages. So you may get to acceptance, but you have a flare up and then you're back to anger, or you're at depression. So we have to work with that.
Absolutely. I'm glad that you brought that up. It's not a linear process
Yeah.
by far, right? This is definitely, you're going to have some detours. Other life
Yeah. You're
events
going to
may
have to,
happen.
exactly.
And I'm
Yeah.
hearing
You're
more
going to
of
have to
this
turn
fluidity.
left. You're going to have to go right.
Right.
Yeah,
Right.
you're
Like,
going to have to go left. You're going to go right. You're going to go this way. You're going to stop. You're going to back up. Yeah, absolutely.
yes, up and down, maybe stop for a second, that sort of thing. Absolutely. This flexibility, what I'm
Yeah.
hearing, this mental flexibility, right?
Oh,
Fluidity
yeah.
through the
Yeah.
process.
Yep.
Um,
Fluidity through the process, because everyone's different in their illness, right? Or their disability.
right.
Right.
Absolutely. Absolutely. And Dr. Lee, how much does compassion play a role in all of this? Self-compassion, compassion for others.
It is such a critical role. And, I facilitate a chronic pain management group, and we started to talk about that last night in group. The antidote of shame is self compassion. That's what it is. And
Mhm.
so it's being able to get to a place where you can talk about your shame. The other antidote of shame is growth, being able to grow into yourself in this new normal and have self compassion. Know that your chronic illness is not your fault, you
Mhm.
know, a lot of times people feel guilty because they may feel great one day, and then they end up cleaning the entire house, and they should not have done that, because the then following day they feel like they've been hit by a Mack truck. So
Mhm.
there's this shame and guilt that comes on. And so what we do as psychotherapists is really work with that, normalize it, and know that it's important to be self-compassionate to yourself, because when we know that you can do that and you can reduce the guilt and shame. Guilt is I did something bad, shame is I am bad. Then
Mhm.
we see a process there of the self-compassion, to where it can reduce flare-ups, and you can be more into your body and being kind to yourself and allowing yourself to feel in your emotions when you need to. That is
Mm.
self compassion.
Oh, that's such a beautiful process. It's not easy by any means, I think, but it is such a beautiful process of growth and transformation, and self actualization. Mm.
It takes a lot of time,
Mhm.
and that's why I always say that psychotherapy is a journey, and it's your personal journey, right? And
Mhm.
everyone's body is different, and everyone's sexuality is different. And so we talk about that, and it's very validating to the client that's coming in.
Mhm. Absolutely. Absolutely. So I'm going to segue us a little bit to go back to potential, like dating, dating, sexuality, when you have a chronic illness or disability. And this is something that comes up in my practice a lot because men who have pelvic pain, um, don't feel comfortable communicating, especially when it's a new partner. Again, there's a lot of expectations for performance, what that looks like. And that is all part of the sexual encounter, which really, I feel like, like you said, the question that we were talking about earlier, it hinders people from stepping out into the dating world, thinking that, hey, how can I possibly be able to have a sexual encounter in the state that I'm in? And so, yes, let's talk about, what is available for folks who want to be dating, go into the dating field while still sick, especially during a pandemic, which actually adds to the layer of complexity of this whole situation. Yeah, what do you recommend?
Well, again, I think it's being able to validate them that, hey, it's so great that you want to date. It's so nice that you want the connection because you are a sexual being. You're a human being. We crave that. We want that, right? Illness, no illness. And the thing that I have to say that I love about dating apps these days is that you could write a dissertation on them.
That sounds like a fun dissertation.
Yeah, I know, right? I mean, you can like list everything that you want, everything that you're looking for. Back in the day with dating apps, you wrote like 3 sentences and then you posted a picture and then you were done.
Right.
Now you can really be very specific on what you want, which I think is great.
Yeah.
Often I have clients that come in and they say, Dr. Lee, I'm ready to date. I know I've got a disability or illness. And one of the things that I have helped my clients do is write their bio. I mean, we've sat with it and we're like, what do you want to say? If you want to disclose, you can disclose. Sometimes, clients, they want to put it out there. So when they do start dating someone, they're not sitting at a dinner table one night saying, oh, by the way, I've got multiple sclerosis.
Mm-hmm.
It's like, let me put that out there now. And if this is something that you don't want to get to know me because I have, well, then you can keep it moving. Right.
Yeah.
So a lot of times people like to disclose in the beginning. And I find that is because of where they're at with their illness. If they are in this acceptance area and they are embracing their illness, which can be very beneficial, who wants to embrace their illness? But if you can form a relationship with it and know how your body works now, and you accept that, that's going to propel someone into wanting to date. And they're going to have the, well, I don't care attitude about it, and I think that's when they've got that motivation. So I think that's out there for them. There's also support groups, like if they're, single chronic illness support groups where people can talk about dating and hold that space. When it comes to sex and you're really wondering what to do with that, I always recommend solo sex. What do you find pleasurable in your body? Pay attention to that, and because you want to know what you like before you go into meeting someone and telling them what you like, right? What feels good to you, what doesn't feel good to you. And so a series of that is this non-demand touching for yourself on what feels great, and people really like that. They're like, I really haven't experimented much with that. And so we talk about that when they're single. So I think those are things that are very helpful to people to be able to do so they can date. They can have a dating life just like someone else does without a disability. It's there.
Right. Absolutely. Absolutely.
Mm-hmm.
And what mentioned some dating apps. Are there any favorite apps that you like to recommend to your clients as far as for dating?
Well, if they're female identified and they're wanting to take the risk, Bumble's always great because you have to ask the guy out.
There you go. Take charge.
Yeah. OK Cupid is great because you can really it's broken into so many sections of what you want to include So people love OK Cupid. I mean, I have a
Okay.
lot of clients that come in and they may have a kink or a fetish, and they're able
Mm-hmm.
to include that on their
Fun.
app or on the platform of it. Um, so those are like my two. And there's Hinge that people like. If they're gay identified, Tinder, Scruff,
Mm-hmm.
Grinder. If you're looking for sex, Grinder's always great. I mean, but there are people that meet on Grinder and they end up having a relationship with each other.
Mm-hmm.
So, or
Mm-hmm.
or they meet friends. They meet friends on an app. So I think that's great. I think what's really hard though with some LGBTQ folks is that
Mm-hmm.
they had to come out of the closet one time and they're coming out again with a
Mm-hmm.
disability. And I think that's hard, because then they're having this like flashback of when they had to come out as a queer person. And
Mm-hmm.
now it's like, okay, now I am in my sexuality, I accept my sexual orientation, and here I am now having to come out with my illness or disability. And that can be really hard. And so sometimes we really have to sit with that for a while.
Right, right, absolutely. Because it's almost like that double negative, right? Had to do it again. It
Mhm.
was so hard. But in those experiences, Dr. Lee, do you feel that some people use those previous experiences to shape the future experience of that? Do you think that going through the process the first time is at all beneficial for, future life challenges, such as what we're
That's
describing?
I'm really glad that you brought that up because I really do believe that when they're able to gain what they learned through the first time doing it, they're able to repeat something like that again. So it's more
Mm-hmm.
empowering. And
Mm-hmm.
hopefully by that stage, they have embraced their sexuality so much that it's easier to disclose having a chronic illness or other disability. And I like
Mm-hmm.
that, being able to say, look, well, this worked for me last time. I'm going to apply this again. And we
Right.
want to be around, you want to date someone and be around someone who's going to accept you you know
Mm-hmm.
that's really big. And so
Absolutely.
we talk about that in therapy. What does your ideal partner look like?
Mm-hmm.
What do you want them to be like? It's okay that you want to be specific. It's okay that you have expectations. We all have
Right.
expectations.
A
So it's
hundred
fine to have
percent.
those.
Yeah. Yes.
Hmm.
And own
Hmm.
them. Own them, name them, embrace them. And
Hmm.
finding those shared values with someone else too. I mean, we're all different and we all have a right to honor them and to have others also respect them too and take part in that mutual partnership.
Hmm.
Yeah. Oh,
Absolutely,
beautiful.
that's
I
what it's
love that.
about. Yeah. Yeah.
That's great. So, as far as any red flags, Dr. Lee, so what are some red flags? You're in the dating world, you're trying to navigate this space, it's challenging amidst the pandemic. What are some red flags that someone should notice while beginning to date?
I think just the lack of empathy. If there's no empathy, if there's like this agenda about the other person and they're overpowering the conversation, they may not be very serious about a relationship. Feeling safe while you're having the conversation, where you're going to meet the person. I've always recommended take your time really getting to know someone because unfortunately there are scary people out in the world and you
Mhm.
don't know who you're really talking to. It's like a vetting process. That's what it is. That's what you have to do. Making sure that you have a very strong support system, because if you don't have a strong support system already, you're going to
Mhm.
take that energy and throw that on to someone else. And maybe you're not taking the time to really get to know them. So I think those are some of the big red flags. And if you have a therapist, process that with your therapist so you can decrease those red flags. Talk
Mhm.
about it out loud. And if it's not going to be with your therapist, talk about it with your friends, your family. Just get that extra support before you start getting out there to date someone or to want to be in a relationship. Because I find when people don't do that and they jump the gun and they go right into it,
Mhm.
then they're feeling hurt or they go through it multiple times. And what
Mhm.
happens is when the hurt comes on, the emotional hurt, then the physical hurt, we see more flare ups.
Yeah.
So you want to make sure
100%.
that you're really taking the time not to jump the gun on things. I always call it mindful dating. Be
I love
mindful.
that. Yeah. I love that. Be mindful, be aware. And I would imagine that that's hard to do or challenging to do, especially when we're not like comfortable and confident
Mhm.
in recognizing, those like visceral cues, right? Like I just know for
Right.
me, it took a lot of work to recognize like, oh, my radar detection system or danger detection system was like, oh yeah, it's ramped up. There's a reason why I'm feeling like that, right? But
Yes. Yeah.
sometimes, I just know from my own experience, you just kind of ignore it or you push through thinking, well, I shouldn't feel that way and I need to be a people pleaser or whatever. And that totally can kind of set you up for a very unhealthy dynamic.
Right.
That was just from
Absolutely.
my own experience.
Yeah, no, but I'm glad you brought it up because there is this people pleasing aspect that goes with it. And, I think a lot of that, of course, comes from childhood when we look at attachments and looking at sexual self esteem and
Hmm.
how that affects you as a people pleaser. But the thing that we have to
Hmm.
realize too is that there are these things from your past that show up and you can change those things. You can adapt differently. You don't have to stay stuck in a
Right.
people pleaser mode. You can adapt to things. Change can be scary, but man, it's so needed.
Oh, 100%. And it's so beautiful once you're kind of like, I always use the image in my head of a caterpillar, like in a cocoon, and like that process of like, just it's so much work to just kind of get out. And then you're like this beautiful butterfly and you have wings that are
Yeah.
expansive and just free. But that wouldn't happen without that process, that transformation of change, that struggle. And so through that struggle is like the silver lining, so to speak, of just such
Yes.
growth and transformation if we are willing to embrace all of it, the whole process.
Yes, the whole process. If you can embrace all of it, right? What's going on sexually? What's going on emotionally? What's going on biologically? What are all these things that are happening? Like
Exactly.
if there's when I have a client that's having more flare-ups,
Hmm.
continued flare-ups, what's going on psychologically?
Hmm.
What's going on there? And a lot of times, unfortunately, when it comes to anxiety, we internalize it onto ourselves.
Yeah.
And how can we change that? How can we make that different?
Yeah.
So
Yeah. Oh my
that's
gosh,
where
yummy
cognitive
stuff.
behavioral, yeah, that's where cognitive behavioral therapy comes in. That's where we look at the thought process and
Mm,
restructure those so you can change the behavior that's happening.
mm, mm. Thoughts are nerve impulses, folks.
They are. You're absolutely right.
So Dr. Lee, what are some things an individual living with a chronic illness should make clear ahead of time, ahead of being intimate with a potential partner, and to be open and comfortable as far as communicating? So, how would you? What advice would you give around that?
I would really like someone to know what they like sexually. What is it that pleases them? What are the arousals? What are the accelerators? What are the brakes? Knowing what that is, being able to just share that with them. Consent, of course, at telling them, hey, I don't like to be touched here, but I like to be touched here. I like to be spoken to like this. I like to feel comfortable when I'm doing this. So I always say that sex at its heart, it's about communication. That's what it
Mm-hmm.
is. It's about sexual communication and really talking about it before you do it. So working up to it, having those deep conversations of what pleasure means to you, knowing what desire is, knowing what pleasure is, knowing what eroticism is. Like if you're wanting to take that sexual risk, talk about what that eroticism is, right? I use a scale with my clients, an eroticism scale from 1 to 10. What is the
Mm-hmm.
low end of the eroticism? Is it to uh, touch a different part of your body? That could be erotic to you. Maybe you haven't explored that too much, or maybe you do it to a 10 where you dress up in leather and you try something different and something kinky. You can do that. And then what is your satisfaction? What does satisfaction mean to you? Is it
Mm,
about having an orgasm? Because there's a lot of folks out there that are not able to have an orgasm.
mm,
So, are you able to have a bodily orgasm? Think of your body like a blueprint and
mm,
map the places that are great to be touched and that are not great to be touched. and share
Oh,
that with your partner.
yes. And that it's yummy stuff. I love that. And you hit on so many wonderful pieces of advice, which I can imagine though, like when you have a first intimate encounter with someone, like sexual intimate encounter, like how do you work with someone to initiate the conversation maybe? Because that can be quite intimidating.
So one of the things, if they're a couple, then I use a dialogue. I'm a big fan of imago relationship therapy.
Mhm.
Imago meaning image in Latin. So when we're born into the world, we develop all these images on what life should be like, right? We get those images from our peers, from our caretakers. So the theory behind imago is that we unconsciously pick a partner based on the positive and negative characteristics of our caretakers. So you may hear someone say, man, she does act like my mother, or he's a lot like my father. And
Mm.
so that's in the unconscious, the old brain. But then we have the new brain. And in the new brain, there's this consciousness. So one of the things that's in Imago relationship therapy is something called the Imago dialogue that I use, where the first step is mirroring, where you send a message to your partner. They can be your spouse or they could be a sexual partner. So you send the message, and then your partner mirrors exactly what you said. That way you're feeling heard and there's a presence. That's a good way to initiate. I want to talk about this. What this is what's on my mind. That way you're talking about it and you're not getting reactive with each other and there's a
Mhm.
presence. The second part of the dialogue is validating, where you're acknowledging their feeling. You're not having to agree with them. I have couples that will come in and they say, Dr. Lee, I don't feel like I need to validate her because I don't agree with her. Well, you're not
Mm.
agreeing with her. You're just
Mhm.
acknowledging how she's feeling. So it makes sense to me that you're scared to have sex because you're afraid it's going to be painful. Is that what I'm hearing you say? Yes, that's what I'm saying. And so maybe we need to take it slow. Maybe we need to do some non-demand touching first to work me up to that. Folks that
Mhm.
have a chronic illness, they really have to go slow with things because
Mm.
there's a lot of fear base there of what's going to happen. And then the third step of that dialogue is showing empathy. It's putting an emotion with what they're saying. So that dialogue is great to use when it comes to initiating any type of conversation. And then we talk about, what does that look like? What does it look like when you initiate sex? How would you want it to look like? And so they're able to process that in the session, so then
Mhm.
they can practice that with their partner.
Mhm.
So I use a lot of that.
Oh, I love it. That practice, that role playing, and in a safe space too, because it can, again, when you're alone, it's like, who's going to be moderating this? We don't want, because there's a lot of emotions that can come up, and we all have various different parts that show up in our life, internal parts that, want a voice, and sometimes we need that moderator, that guide to say, okay, this is coming up, and
Right,
recognizing
right.
that. Yeah, that's
Right.
so important.
Sometimes we need structure. And so
Hmm.
sometimes they do that in the therapy session if it's a couple, but even if I'm working with an individual client,
Hmm.
they can have the dialogue on hand so they can use it
Mm.
with a partner. And so we
Right.
work up to that. And I think that can be very helpful. Sometimes people don't know how to talk about sex. So if they don't know how to talk about sex, they need something to start the conversation. So there's these sentence
Mhm.
stems that they can use. I want to talk about pleasure. This is what's pleasurable to me. And then they can share that. So, really starting off with the basics when it comes to that, because there are some folks that have chronic illness that don't even have never had a sex life prior to the illness. So,
Mhm.
what was sex like prior to that? If they were a couple, what was your sex life prior to a chronic illness?
Right.
Were you sexual? Were you not sexual?
Mhm.
So sometimes we have to really start slow and at the basics. When I first became a therapist, I went into helper mode so much. And I've learned to really slow down and just let the process take its course.
Mm. Mhm. Oh, wise. Wise. So, on that note too, um what if let's switch the gears about how their partner or someone's partner could respond. And as well, yeah, how could the partner respond, and what are some appropriate ways of discussing sex and how to go
Mhm.
about it in this circumstance?
So I think the partner can just, I think one thing that I would really recommend is a presence and to just listen. I think listening is very powerful. not jumping the gun. Because a lot of times I find if there's a healthy partner, they really want to get back into the sex that they used to have. That's a big thing. I see that a lot. And so they're adjusting to, they're full of anxiety. One of the things that they're really scared about is, are they going to hurt their partner?
Mm-hmm.
You know, sometimes it's the chronically ill partner that's like, hey, I want to get back into it. Take me. Let's do it now. And then the other partner's like, wait a minute, no, because you have this condition, and are you going to be safe? Are we going to be safe? So sometimes there's a lot of anxiety. So when
Right.
I work with couples, I'll do some individual sessions with each partner, or I will recommend that the other partner get a therapist so they can voice their concern.
Mm-hmm.
They may have
Mm-hmm.
some caregiving stress going on where they have switched roles into a caregiver, but a lot of times they like being a caregiver. It can be an intimacy builder. It can be something new for them. So it's not always a negative thing. So I think holding space, I think being present and just asking, getting curious. So my mantra is get curious about your partner and get creative with your sex. Get
I love
curious.
it.
Get curious about your partner that has a disability. What is it that you like? What is it that I can do? What is it that I can make you feel comfortable? So there's a curiosity that has to happen.
Mm-hmm. Mm-hmm. Oh, I love it. And just so, just leaning into the strengths and vulnerabilities of ourselves, it sounds like, right? And again, you're creating this
Right.
sexy team, this intimate team. It's an intimate partnership.
Right. It's an intimate partnership, and you're getting creative, which is
Oh.
so needed. So instead of looking at the chronic illness like
Mm-hmm.
it's doomed your relationship, look at it like, okay, there's a change here. And
Mm-hmm.
that goes into the integration stage of a chronic illness, that it is one part of my life. It does not define who I am. It's something that I have. It's
Mm-hmm.
not me. And I think in the beginning of treatment, it's very much, this is me, this is who I am. Well, okay, it's a part of you, but it doesn't define who you are as a person and who you are as a sexual being.
100%. And my mother, she was born with spina bifida and also
Mhm.
had a lower limb amputation when she was in her teens. She modeled that so well for me. Just so
Yeah.
well. She's just like, I'm still a badass. you know, Talking about sex, you
I
know?
love that.
I mean,
Yeah.
I mean, it really, she modeled that, and just on her own, honestly. I mean, she never really like let that get in the way at all. And it's even when, my grandmother loved her to death, but the generation and the mindset was that of like, oh, you can't act like that. You can't wear a skirt. You can't show your prosthesis. You can't, et cetera,
Mhm.
et cetera. You need to be with somebody who's going to accept you for who for who you are, because who would, they're like a martyr, right? Like all of those messages, which were so negative. And I remember just as a kid and as a teenager, like when I used to live at home, like so pissed off, like, what the, like, no.
Right.
And then
Yeah.
seeing my mom be like, sorry, mom, like to her mom, like, sorry, mom, but fuck that. I'm wearing leggings. I'm gonna wear a skirt. If I want to take off my prosthesis and go swimming in the ocean, I will, because I can. I don't give,
Or if I'm gonna take it off and I'm gonna have sex.
That's right. Exactly. Exactly. 100%. 100%.
Yes,
Oh yeah.
absolutely.
Oh
Because
yeah.
there's these messages, we get negative sexual messages. And if you are born with a disability, or you end up, coming down with a chronic illness, your family or people tell you, you can't. I've had clients come in and talk about this, that you can't be sexual. You are asexual, meaning that you don't have sex, it can hurt you. You don't need to be asexual. And I've had clients come in and they say, you know what, Dr. Lee, I feel like maybe I should believe that I am. If I've
Mm.
heard, because these messages are traumatic, they become
Yeah.
ingrained in you, and
Mm-hmm.
they carry with you. And so when you have these messages, that's going to determine your sexual self-esteem. You're
Mm-hmm.
going to have a positive sexual self-esteem, or you're going to have a negative one. And
Mm-hmm.
that's going to hinder you and have this um, performance anxiety that happens with it,
Mm-hmm.
or there's the low sexual desire that comes with it.
Mm, mm-hmm. Totally agree. Oh my gosh, I could talk forever, Dr. Lee, with you on this topic. You are so fun. And honestly, your wisdom has been just a breath of fresh air. And I'm so privileged and grateful that you took the time to be here with us today to share this and have this conversation. So, what resources for someone who wants to learn more, for people who are listening or watching, are there any resources that you would recommend? And a little birdie told me that you're working on some projects yourself. So please, shameless plug away.
I am. I'm working on my first book, which is called Sex and Love When You're in Pain, which is going to be about reclaiming sexuality due to chronic illness and disability. I also have a podcast, which is called the Sex and Chronic Illness Podcast, which is part of the Invisible Not Broken Network. We are 4 podcast hosts with 4 different podcasts. We have Explicitly Sick. We have the Human Care Podcast, Discomfort Zone, and then mine. You can access that podcast at my website, drleephillips.com. If you also go to my website under the resources tab, I have a list of resources there for chronic illness and disabilities. I have some of my favorite books that are listed there that you can read about. And then if you feel like you ever need to get in touch with me, you certainly can at Dr. Lee Phillips on Twitter and Instagram and Facebook. And you can also contact me on my website, which is drleephillips.com. This October, I'm going to be doing a big interview with Esther Perel on sex and chronic illness and disabilities, which I'm really excited about, on her online sessions platform, which will be great for clinicians that are wanting to really learn more about this, but also for clients and people too. So I'm really looking forward to that interview. That will be very helpful and will be a great resource because it will be on a hour platform with a live Q&A that will come with that. So stay tuned for that. I'm really excited about that interview.
Thank you so much, Dr. Lee, for sharing all of those resources. We will be sure to link all of those in the podcast show notes for folks. And also, deepest gratitude for being on the show today and taking your time to share such beautiful wisdom and encouragement for folks to ignite their sexual identity and reconnect with themselves, and to really get that sexual freedom, no matter what may come our way as far as what life may bring us. So thank you so much for all the work that you do. It is so appreciated by myself and others. And to all of our listeners out there, thank you so much for being here. And as always, in loving wellness for your pelvis, this is Dr. Susie G. Bye.
Thanks for listening to today's episode. Be sure to head on over to drsuzyg.com where you can get more information, show notes, and related articles on today's topic. Also, if you like what you're hearing, head on over to iTunes, subscribe to the podcast, and leave us a rating and review. We'd love to hear feedback. Thanks again.